Welcome to Rebecca Sounds Reveille. This week we have got another fabulous guest. He's been on my show before, and I've got to tell you, he is absolutely phenomenal. You may already remember the episode that we have with Ronald Chapman. He is an amazing man with so much information, I've got to tell you. And for those of you who haven't seen the last show, you've definitely got to take a gander at that one because there's a lot of information there as well. But he's an author, a speaker, and a facilitator. But I've got to tell you, he's got even more to him than just those things. And his desire and his passion and his approach to increasing well-being and producing breakthroughs is just incredible. In fact, he has his own focus. He has something called Seeing True and Progressive Recovery, which on later episodes we're definitely going to be talking more about. But he also has two core businesses. One is leading public health, and another is Magnetic North. And those I'm going to let him share with you a little bit about. He has also been a national award-winning radio commentator on KUNM, which I believe is New Mexico. And so that would be an area that we're going to also want to explore at one point. But he's also an accredited speaker with Toastmasters and has so much more. And we're going to talk about some things today and how he's been affiliated with WHO, the World Health Organization. And he just really broadens a perspective in ways that sometimes many of us don't think about. So I'd like to welcome him today. Welcome Ronald Chapman to the show.
Delighted to be back. Thanks for having me, and who knows where we might go.
That's exactly right, because you have a direction that many people wish they had either gone on or started down, because the information that you've been able to share and garner and help others with has been absolutely incredible. But I want to talk to you today a little bit about your business in leading public health, because this is something I think we really need to address. There's so many topics on the horizon, from vaccination to just what's going on with communicable diseases and so on and so forth. And it's kind of all just sort of mushed together. And I really want to get to something that is the foundation of really moving forward. And much like your progressive recovery would be that in public health. So I wanted to talk a little bit about the organizational structure within the public health system and hear what you have found.
Well, at public health, the place we have to start, honestly, is to dissuade people from the things they don't know. Right now, at this very moment, you don't hear about public health because it's working. Everything from fluoridated water, which is a public health strategy, vaccinations you mentioned, the public health community is on the scene when things like Ebola break out, the big concerns with that. Chronic disease prevention, public health has been on the lead in dealing with smoke-free environments, which has had a benefit to many, many people. I mean, everything from asthma, good baby outcomes. That's not good public health speak, but that's the way I like to talk about it. And
yes.
The tragedy in public health, honestly, is that so much good work is being done. For example, all the people in your city right now who are not going to get sick today going to a restaurant because public health has been ensuring that they are using good, safe practices for food handling.
Mm-hmm.
We never hear about it until something goes wrong. And that is really, really unfortunate because so much good work is being done today with this infrastructure, both at the federal, international, state, and local level, that we just simply do not take for granted until something goes haywire or we have a great need.
I have to agree with you. There is so much that we do tend to overlook and forget about until something happens. There's some type of media spotlight on something that's going on from one employee doing something intentionally to other things. And then, yes, the spotlight goes directly on that, and that's all we think about. And so this is really very interesting. How did you get started in looking at the organizational infrastructure?
Well, about 20 years ago, someone who knew I do a lot of work with strategy and process facilitation and leadership development and so forth asked me when I still lived in New Mexico if I'd be willing to work with their tobacco prevention programs across the state. And I said, sure, I'm pretty much willing to go almost anywhere, Rebecca. And that opened a door that within the course of a few years, actually, I ended up in Atlanta because of my proximity here to the Centers for Disease Control, as I slowly have worked across the nation and internationally in any number of venues working on these public health issues. And as I've delved into them, because my core orientation is towards organizational performance, healthy workplaces, and so forth, it's a huge bit of infrastructure in which there are lots of opportunities to make a contribution. And so I just continue to show up, and folks in public health keep inviting me to help.
This is fantastic. What so far has been the most fascinating or maybe overlooked area that you have seen just some fantastic progress?
Oh man, that may fill up the rest of the hour. the best. Okay, so I'm going to tell you the one that probably has had the most impact, and then I'm going to tell you one that enthralls me the most currently. Honestly, the one that has had the biggest impact, and this is global, is preventing exposure to tobacco smoke.
Okay.
The data that indicates all the bad health outcomes from us just passively being exposed. And so all those places now, from restaurants to workplaces, some folks in my age bracket can remember when hospitals were filled with tobacco smoke. And I mean, it's a huge public health success worldwide in preventing exposure. And that is a big deal for health. Everything from, of course, cancer prevention, minimizing the effects that tobacco smoke might have on people with asthma, heart attacks.
Uh-huh.
Heart attacks are much diminished when you're not exposed to tobacco smoke. So it's a whole host of things, and it's a big win in really a relatively short period of time.
That's interesting.
Oh, Rebecca, it's huge, and we take it for granted now, except if you live in a place where most of us do now, where you're not exposed to tobacco smoke, and you go into some place where you're suddenly exposed to it, and suddenly most of us recoil, those of us who are non-smokers, and it's like, oh my God, this is terrible. And yet I'm a baby of the era where you grew up sitting in the back seat of the family station wagon with the windows rolled up and both parents smoking, and just 5-year-old kid enveloped in tobacco smoke.
Well, I can remember that. I can remember restaurants and so on and so forth, and nightclubs, and okay, so I did do a little nightclubbing back in my younger days, but it was something that was very common, and a lot of us just really didn't think twice about it, especially if you came from a community or a family structure that it did that. I mean, it was a lot more of the norm, so many people didn't look twice. And then here's this big movement. But I'm wondering, is this something that is a federal law that business establishments can't have, or does it really boil down to city ordinances?
It's mostly city ordinances. There are some statewide and, of course, some significant federal control through the FDA, but largely it's local ordinance. And
Okay.
this is one of those cases where the governance is kept largely local, which I think is generally by most people thought to be really good. It does make it harder, of course, because if you've got an entrenched locale that just doesn't want to go there, it can be more difficult. Of course, people are being exposed, and I know we have strong feelings about don't want Big Brother and all that, but essentially, people who are exposed to tobacco smoke are unwilling participants, and so this is where I think government really does have a role to play.
And I really can respect that. What's really interesting too is as things that kind of go overlooked, this is an area of government that is overlooked as well in really allowing localities to maintain different control levels of what's going on in their community, and we forget that. So sometimes we're thinking, when we go to a new location and we see this, we're thinking, well, isn't that something that is common across the country? You're not supposed to have these type of establishments, and yet it's a local ordinance.
Yeah, and so it is a challenge to do locally, and yet that does seem to be the preferred approach. I mean, the nice thing is that we've slowly seen smoke-free places essentially ripple across the country, North America, and certainly increasingly around the world, which is a really wonderful thing for those places that are still. And of course, Asia has some real challenges with the amount of tobacco smoke exposure, but progress is being made, and most good things take time.
Oh, absolutely, they do. What is the method? Does CDC go down and talk to city council?
No, CDC is very hands off. They really let local and state people handle everything because that's the nature of the arrangement. The federal system supports states and localities in a lot of public health. There are cases where federal level public health response, things like emergency outbreaks.
Mm-hmm.
There's certainly federal coordination when we have, for example, the hurricane response. FEMA was very present. The CDC, when there's anytime there's something of significance like that, they deploy a number of their people to be boots on the ground. In fact, a number of my clients recently with the hurricane outbreak had to reschedule things with me because they were called up for duty in an instant. So, but essentially, much of what we see happening is sanctioned federally, but it's really managed and controlled locally or at the state level.
That's really amazing. So when something like the topic of secondhand smoke comes up, and the idea is to really educate people so that citizens do not become subject of these toxins, how does that kind of trickle down federally to the local level on education? Do they email things out? Do they, how does that work?
Well, right now, and I mean, this is like some of the magic elixir behind the scenes that people don't know about, but right now, of course, there is federal legislation that is handled through the FDA in terms of controlling tobacco exposure. So that's a federally mandated piece. But the CDC essentially, and of course NIH, National Institutes of Health, does lots of research related to causal factors. But CDC is principally a conduit for expertise.
Okay.
So what they do is they support somewhere in your state at the state level, there is a relative handful, perhaps two handfuls of public health professionals. They work for your state government. They are supported by the CDC's expertise, their knowledge, their science, and essentially it is the combination of that expertise managed through your state Department of Health or Department of Public Health.
Okay.
Which is coordinating. So, for example, in any given city, which also has its own public health department, a large city typically, smaller communities don't often have much. I mean, they have health departments, but a lot of that is on, on the front line work. And so there's federal guidance, federal expertise, subject matter expertise, but the state then becomes the, the conduit through which the work is done in communities where community resources, and then there's a huge body of coalitions and support, people who care about these issues, who are volunteers working behind the scenes. And then, of course, there's American Heart and American Lung and American Cancer, and they're all concerned with these issues, and they bring their respective expertise. So there's this whole web of public health infrastructure that at this moment is operating, and nobody knows that it's ongoing, which again is unfortunate, because the only time we find out is when something goes wrong.
Oh, that is so true. That is so true. And, it's very interesting, though, to think about, because there's so many different types of activism and so many different types of passions that people have, and we tend to not know about many of them.
Right. The coolest thing in the world when you get into the public health space, and I'm going to give a shout out here. One of the things that I've been offended by for 20 years, to be really honest, is the remarks that are made about government workers. I mean, I've worked the private sector. I've worked in academia doing these sorts of activities. And these are dedicated, passionate, hardworking, underpaid people. And every time we disrespect them because we don't know any better, we're really injuring ourselves, because they care a lot about these issues. And they are out there. I mean, we typically see them when, like the hurricanes, when there's a tornado, when there's an outbreak, when there's some kind of a problem. And yet there's this remarkable infrastructure operating 24/7 that is protecting us from all kinds of things that we don't know about. Or you may see it pop up when you're watching The Walking Dead and the CDC shows up, right? With the protection.
Right, or like the History Channel, right? You'll find a lot of information watching a lot about different things like that, but we tend not to think about what really goes on behind the scenes. And I like that you're sharing this, because I really feel that we have so many organizations with such a passion to help people, and then we have the spotlight of what happens badly, and of course then we talk about that, and we also tend to open our eyes to things that we weren't thinking of. So in some ways, it's a double-edged sword, but most of the time we're not giving credit where credit is due. And I have to agree with you. We have so many government workers with such a pure heart, with good intentions, and that are working, and they are definitely underpaid and under-recognized.
Yeah.
And you'll see this oftentimes too in even like the Veterans Administration. You're hearing tons of things about all of this facility that is having this challenge, or this wasn't done. But there are workers there who, medical doctors, practitioners, administrative, there's people there who really care, and there's just so much on their plate. They may not be able to get everything accomplished in the timely fashion that needs to get done because of the amount of things that are needing to take place, but it's there and they're working hard. I see this in so many different arenas, and when I go to different places, I've got to tell you, it's just amazing, because I really will recognize that worker, and they'll say, "Oh, girl, thank you." Because most of the time people are going into whatever establishment that it is, and they're complaining. And sometimes I really feel like even if we are experiencing something challenging, if we're there and we're in person and we make that connection as a human, because we're in the age of texting and computers and instant messaging, we forget that people have emotions, and we at least let them know that we appreciate the services. If we did that on a massive scale, how different would things be?
Well, I tell you what, they go to work the same way most of us do, wanting their work to matter. And I think a lot of people do feel like their work matters, but it's very much undervalued, particularly in this present political environment where government is viewed through quite a negative lens. So yeah, if we could acknowledge and recognize, and probably more importantly, Rebecca, to become more knowledgeable on these subjects. I know one we talked about last time that I wanted to make sure I give another mention to is, the whole outbreak with opiates.
Yes.
When you start looking behind the scenes, when you really look at how the epidemic is occurring, it's a public health problem. It's not an individual problem, which is so often the case. I should probably say a word about that in a moment. But when we look behind the scenes and we see the infrastructure that's needed to actually support people, not just in getting off opiates, but in not getting hooked in the first place.
Yes.
I mean, a lot of that is what we call systems work. I'll give you a real simple example. A lot of the, and I'm not a subject matter expert, so I may not quite hit the mark on the exact details, but I'll get the gist of it here. If you look at how prescriptions are dispensed in the US, essentially it's controlled by state law.
Okay.
That's a default number of pills. So prior to work in this epidemic area, the default might be set as high as 25 or 30. So a doctor writes you a script for some opiate because you have pain. He doesn't specify the amount. You go to your pharmacy, they automatically gave you 25 or 30 pills, which is more than enough to get hooked on. Well, so one solution is drop the default setting. Go to the state, change the law so that when your doc says give them X, right, for whatever condition, that you get 5 pills to be used judiciously, which for many people is not enough to get hooked. So when we turn this into and I know you care a lot about this issue, Rebecca, and so when we turn this into an individual behavioral issue, we fail to understand that if you give enough people 25 or 30 opiate pills, a lot of them are going to get hooked. So rather than blaming the person, let's change the system so that the average person isn't exposed enough to get hooked, which sets up something I think we talked about last time, which I know we don't need to repeat. But right now the estimates are that 4 out of 5 people going to heroin started on prescription drugs.
Yes.
So,
yes.
So crazy enough, right? It's not marijuana that's the gateway drug. It's prescription opiates that's the gateway drug. And so when we look at this from a public health point of view, we look at the ways to prevent it mass population level rather than individual, because it's so hard to do individually. So it's a really good systemic example of how public health ideally works behind the scenes so that a lot of the things never even present themselves. That's an ideal outcome.
Yes, my biggest passion is prevention and education, because I feel like that is really the key to becoming a solution-oriented society. And so I have to concur with you on this, and I will share with you something that, I had an injury, and I was given a prescription. And actually, the thought of taking it was very scary to me, to think that this was a potential that could, not only for me, but anyone, be something that could be habitual, right? So I really did not want to take it. And, the thought to me was, okay, this is great. I have the prescription, but unless it is that bad that I cannot tolerate it, and you have to think about the scale that they ask you, what's your pain level today? 1, 2, up to 10, right? I mean, it has to be completely over the top to take that. And I think what's happening to people who get hooked is the minute they feel pain, they begin to go, oh, I know that this is going to take it away. So before it gets, any worse, I'll just pop a pill. And then the next thing you know, they're popping more and more, because we are numbing ourselves and not allowing ourselves to really do what our body does. And sometimes you just really need to ride some of these things out and really be able to identify what's going on. And pain is something that our body begins to tell us that there's an area that there's something going on, right? So we need to think, okay, what can I do to resolve that or prevent that pain from happening again, besides relying on something synthetic that's masking my ability to fix it. So whether it's, you know, an injury on your finger, arm, leg, whatever, where you do some type of physical therapy and strengthening exercises and things like that, people are becoming oblivious to this and then creating an addiction and never really curing or fixing or healing. And that's a huge problem. And I want to ask you something, because going into the gateway of drugs, we've come so far from what has been considered, you know, marijuana, then we've gone to the opiates and so on and so forth. But there's a new drug on the horizon that supposedly is just in another country right now, although there is suspect that it has hit the northern part of California, and it's a flesh-eating disease, much like the high that someone would get from heroin, but this really just destroys. Within 2 years, somebody is pretty much certain to have morbidity.
Yeah. I suspect most of us have seen the photos. There's like, they're on social media, the before and after photos, someone 2 years later, and they look just, I mean, it's really as destructive as can be to them. And I mean, I haven't heard that there's a mass problem yet, and I suspect that's because we still have stuff that's blatantly obvious, right? There's still so much shame around addiction that we I think generally prefer things that stay out of sight.
Mm-hmm.
And so my suspicion is there's less, and this is a guess, of course, a less likelihood of that becoming a mass challenge, unlike something like injectable opiates, injectable heroin, because you technically can't see it as long as someone's wearing a long sleeve shirt or whatever. But I think the underlying question ultimately in that area, and I don't want to recover all the ground we covered before, but you know, if we really get down to prevention, we've got to start asking ourselves some hard questions about why so many of us are prone to addiction.
Mm-hmm.
Because I know we love to make it a personal issue. I mean, I know we love to do that in our culture. But that does not seem to be sufficient enough explanation for what's going on. And a woman named Chellis Glendenning wrote a book called Off the Map, where she looked at the underpinnings, the sociological underpinnings of addiction. And I consider this a public health issue. I suspect some of my public health clients would as well. Her conclusion in her work was that when people when they suffer extreme loss of meaning, especially if we look at indigenous peoples who've lost the connection to the land in many cases, loss of meaning. Now, the reason I really love this way of thinking, I don't like the subject, but I like this way of thinking, is it in some ways what we've seen devastate Native Americans, for example, are disproportionately affected by addiction. They've been devastated from the historical underpinnings. It's the same story we're hearing from white middle America. Is people are experiencing a loss of meaning, a loss of their purpose, if you will, using what they believe to be the traditional foundations. And of course, we're seeing this huge outbreak in white middle America, especially in men, apparently, the data says. It seems to be the same problem, this loss of meaning. It becomes a spiritual problem, if you will, rather than a drug problem. And I know nobody wants to go there because it's like, oh, no, let's treat this with pharmaceuticals or something. But if what we're seeing is a tremendous loss of meaning across our culture, that's a whole nother problem that needs our attention. And if it's true that stuff is at the root of people's propensity for becoming drug seeking or alcohol seeking or anything else, then we have a much larger social issue to address, some of which now we're in economics and poverty and all the educational access, all those subjects, which are all actually public health space.
Yes, and there's such a ripple effect, and I really want to, really kind of focus or hone in on something that you said, and that was the meaning, the loss of meaning with things. And I think there is so much of that right now. And we'll go back to what's being brought out in the media, and that is, I mean, we have just some really horrific situations that have been happening across the country, and it seems like there's this numbness that some of it's becoming so, I don't want to say common, but brought out in a public way so much that there is just this missing link in meaning. Yes. And with technology as well. I mean, we're cutting off so much, Ron. I'm sorry. I'm thinking about where has the disconnect stemmed from?
Well, you get really interesting now, Rebecca. That's kind of like the $64,000 question, isn't it? I know that some would argue that we need to just go back to some historically appropriate time when we were communities and connected, except we know that there were a lot of people that were not part of that. So clearly what seems to be presenting itself is a breakdown, and I don't think it's a social breakdown. I think it's got something to do with the pace with which our culture is changing, the fact that gender roles have changed, rightly, wrongly, good or bad. I'm not
right.
Frankly, I think it's wonderful that women can have professions. I don't think we should go back when women only could be housewives. I think that's a real benefit. I think it's wonderful that we have many, many faceted perspectives. And yet what it's precipitated is a lot of the things that make us community, make us have common cause, are becoming harder and harder to find. And a lot of people are experiencing, I mean, I would call it, I'm a social worker, I'd call it a great deal of grief and loss over things. They've lost their bearings. They're scared of the loss of bearings. Much of what's currently going on in our very divisive public dialogue isn't helpful because it's not really supporting getting to the common root. In the end, it is useful to remember that most of 7 billion people today woke up trying to have a pretty good day. That most of them, most everybody you and I are going to encounter is just trying to get through the day and pay their bills and feed their
yes,
do something meaningful with their life. And yet we're being rocked by the technology and everything else. Some think, I'm getting really tentative here because this gets kind of out on a limb, but there are some who are supposing that we're on the brink of a breakthrough. Some fear it's the brink of a breakdown. The brink of we're going to, sooner or later, it's my opinion, we're going to have to face this breakdown. We can't go back to the mythical year of 1954. We just can't do that. It's not going to happen.
Right.
We can't suddenly change the composition of our population, no matter how people feel about it. The genie's out of the bottle with regard to what people believe and what they do with their lives. So we clearly have to move towards something rather than back to something. Because
yes.
Voices. I'm hopeful that we will find ways, like in dialogue like this, to talk about a more hopeful perspective on these things. And
yes,
a way to reestablish community, common union, because in fact most everybody today, regardless of ethnicity, religion, etc., most all of them today they're just like you and me, just trying to get through the day and have a pretty good day.
I have to agree with you. And I don't want to go away from what you said earlier, and I'm sort of going to change directions on you because I think what you said really pinpoints everything. There's another area that you said enthralls you.
You want me to tell you about that?
I do.
Okay. I am enthralled with preventing birth defects. It turns out that in the U.S., we don't have too much of a problem with this, mostly because of the micronutrients that are put in our grain products. So when you eat a slice of store-bought bread, you get a whole dose of micronutrients that dramatically increase the likelihood of a healthy baby. I mean, dramatically. Well, any place where people don't get those micronutrients, either because they're not injected into the food supply or there's not kind of supplementation. The estimate is that there are 250,000, 250,000 birth defects a year that are preventable by micronutrients.
No kidding.
250,000 a year that are preventable. Now we're in your prevention space again.
Yes.
So all we have to do, it's not quite so simple, else it would have been solved. Ultimately, all we have to do is get those micronutrients into people's food supplies, and 250,000 babies a year will be born without these preventable neural tube defects.
Mm-hmm.
The whole body of again, I'm not a scientist, but there's a whole body of research that shows just how far this goes, and so right now there's an effort going on that I'm doing some. I don't want to claim any credit. They're the smart people doing the work, but I'm helping them figure out how to navigate this space. And they're trying to figure out how to get those micronutrients into the food supply, because if you can get it into people's, grains, is principally where it comes from, milled wheat, milled corn, etc., milled rice. All of a sudden, you have this huge good baby outcome, and I'm excited by that because, Jesus, if I was going to spend my time working on something, why not have a hand in trying to prevent 250,000 birth defects a year? That strikes me as a good use of my time.
I have to agree with you. And, that is an area that I think has really been something that people look at on the opposite side as far as processed foods and so on and so forth. And we are lacking a lot of the nutrients that are needed. And yet, in the same sense, people are saying, well, I can't afford it because a lot of these foods end up costing so much, and it's easier for me and cheaper for me to just grab the processed food than it is the other. But we're finding that this is essential in having a healthy lifestyle, is getting the nutrients you need. And with the supplementation, or I should say supplement era that we're in, are micronutrients something that people can just grab through a vitamin, or is it really something that needs to be consumed through food?
Well, there's a debate about, well, I don't know if it's a debate. Yeah, supplements work, especially for these valuable micronutrients. The one we're particularly talking about with birth defects is folate.
Yes.
Is the primary, but there's a whole host of these. And yeah, you're right. I mean, and again, this is public health. Public health has been working to make sure that everybody in the developed countries is getting these micronutrients. It's all those little things on the back that some of the stuff's bad stuff, but some of the stuff is really, 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 really important. And so we've got this strange conundrum. Yeah, we should eat our fresh broccoli and so forth, but those micronutrients that we're getting in our bread products, for example, are just hugely valuable. So the challenge becomes, let's talk about, Southeast Asia. There's a good place to go. The challenge is, how do you change the infrastructure there? So those micronutrients are just part of the food stream. That's where the solution is, because it's like right now, that slice of bread that you ate whenever you last ate it, Rebecca, like a fraction of a penny to get the it is so inexpensive. But it's an infrastructure problem. How do you get those injectors in the mills and get the policy passed and so forth? Public health works behind the scenes trying to figure out how to facilitate that. It doesn't really cost manufacturers much, so it's not a burden on the economy. But there are all these things, especially if you're in a rural setting or under-resourced area, where it can be more difficult. Hence, work by Gates Foundation and those kind of NGOs that are really trying to figure out how to solve these problems. And it's like so overlooked. Every day, women in America are being supported in having healthy babies just by eating some of these enriched products that make all the difference. And we completely overlook it. It's public health is what's making sure that happens.
This is very interesting. And I know that, there is so much to education and prevention in so many ways, and we do overlook these things. If someone wanted to really kind of get on board with this, is there a local resource that they have they can go to?
Well, that is part of the challenge. Is it's not so readily accessible, um, because it's a huge body of work.
Okay.
First thing I would probably do, since we are in a web-based culture, is I would Google, or whatever your search engine is. I would look for um, public health prevention.
Okay.
It will begin to take you to all kinds of places that will tell you all kinds of things. And if you want to localize it, public health prevention, Harris County for Houston, right? Public health prevention, Idaho, if you're in Idaho, and start to see what comes up, because there's like this wealth of stuff going on that we just totally take for granted.
I love it. I absolutely love it. I want to thank you so much for being on the show today. This has been very eye-opening, and I think that this is a great start for the audience to get educated and begin to take hold of some things that they need to know. And you've given a great resource on how to, I mean, even just by utilizing their search engine, there's so much that they can find in their local communities. But we have more to talk about, and we are going to talk again. I know that you now are going to be a regular on Rebecca Sounds Reveille, which I am just ecstatic about, because there's so much you have to share. And today, this has again been just very refreshing and eye-opening. I want to thank you so much. For those who would like to get copies of your book, would like to know more about you, public health, and so on and so forth, would you please share some of your sites so that they can too start making a forward direction in prevention and education?
Sure. Well, Ronald.com will get you to everything I do. I've got multiple sites doing different things. I just don't seem to have enough time in the day. I put a lot of free content out every week on seeingtrue.com. Most of it is, I guess, in the space of transformative work. That's how I think that I spend most of my time working. And free content, you can check that out. If you're really geeky about this public health thing, leadingpublichealth.com is my site for that body of work that I do. So I'm happy to have people track it down, and you can reach me there. And I just can't resist a good question, so feel free to send me questions.
I love it. Thank you so much.
It's a pleasure.
And I want to thank all of you for tuning in again to Rebecca Sounds Reveille, where we are always utilizing Reveille to wake up people about things that they need to know. And we ask that you share this episode along with the others with your friends, family, via social media. And again, just stay tuned, because there's a whole lot more for us to bring to you, where you too can shout out Reveille. This has been brought to you by the Liberty Beacon Project and TLBTV. With me, my guest today, Ronald Chapman, and I'm Rebecca of Rebecca Sounds Reveille. Thanks for watching.